Hi, I'm Zach Kulsrud with Dental Economics. We are wrapping up day 2 of IDS 2019, and this is a great way to end it with Don Casey, CEO of Dentsply Sirona. Don, how you doing?
Great, Zach. So do you have a good day? I mean, a lot of action, a lot of activity out there.
We have had a great day, and judging from out there, there's a ton of energy on the floor. But we're in here in the meeting space because, honestly, it's a little crowded out there by your booth. It's buzzing.
Yeah, you know what? I tell you what, I am first so proud of our employees. I mean, these people have been working for 6 months to make sure that this is an IDS to remember. And then about a year ago, we sat there and said, we need to focus on better innovation, bigger, better innovation. And credit to our R&D team, we got very focused, and we think that we are bringing some pretty important products for us, and it's all come together for a big IDS. So the buzz around our Prime Scan, our Sure Smile, our Sure Fill 1, we're pretty excited about it.
That's great, and we'll talk about those products specifically, but I'm interested to get your take just from a macroeconomic level. How do you, as a company your size, you look at the health of the dental market? What do you see?
You know, it's interesting. So just from a purely financial perspective, there's a lot of questions that came out of some US reporting of some of the bigger distributors and partners.
Sure.
And you know, I always point out and sit there and say, first, we're truly a global company. And second, we participate very, very broadly. So companies that may not be participating in some of the specialties and like implants may have a very different view of the market. I would tell you, I think the oral health market is very, very good. If you look at how fast things like clear liners, if you look at how fast implants are growing, I think you're seeing a lot of health, in particular the adult aesthetic business. I think some of the innovations that you're starting to see that are driven digitally, and some of the relationships dentists are beginning to build with labs, it's a very, very healthy business. So, we looked at toward the end of 2018, we saw some pretty positive trends on a global basis on both the technology and equipment side and the consumable side. So we feel the underlying economics and the underlying health of the dental category is good.
Good. And so a lot of people, a lot of the dentists in our audience, they don't have get to an inside look at how the dealer relationships at this meeting can really shape some things that happen down the road. Can you talk a little bit just about the business side and what you're doing here to kind of make connections as dentistry itself, the business of dentistry evolves with DSOs, et cetera, et cetera?
Sure, it's interesting. Integral to our business model, Zach, is that we use dealers in a lot of places, in most of the world. We believe that dealers provide a couple really important services to our customers, and that's really critical to us. I mean, it's interesting. We have 160,000 plus SKUs that, if you take the US market, that are going to 150, 200,000 dentists.
Sure.
That is a very complex process to get there, and our dealers do a great job on that. The second thing is, particularly in the technology and equipment business, sometimes physically things go wrong. I mean, whether it's our technology or equipment or a compressor goes down, and you almost have to look at the business of a dentist's practice as almost an assembly line where, if a chair goes down, an x-ray machine goes down, a CAD-CAM machine goes down, they're kind of out of business for there. And our dealers, in our opinion, provide a great way of getting service very, very quickly and getting the dentist back up and serving patients. The third thing they do for us is actually help us create demand. So in the case of, let's take something like CEREC, which we're very excited about, we have a direct sales force, say in the US, and we have that in a couple other countries around the world, but that's not nearly big enough to cover all the dentists. So the dealers, in our mind, provide an expanded reach. They're working with their customers day in and day out, and whether we generate leads out of our sales force or the dealer comes to us and say, hey, Dr. Casey would really like to evaluate a CBCT, we'd say, yeah, let's work together in doing that. So, in our mind, the relationship with the dealers is integral about how we make sure that we are serving our customer very well.
So then let's switch then to a little more granular, and if I'm just your dentist out there and I'm trying to look at what Dentsply Sirona is doing in terms of products that are going to help my practice. You spoke about the pride you had in your R&D team. What are some of the things that are coming down the pipe, and maybe even at this show that you're saying, hey, general dentist or multi-practice dentist group, here's a solution that you really are going to be interested in, that we worked hard to come up with?
Sure. It's interesting. We're starting to really look at the market we actually put customers, then we put procedures, then we put products. And for a long time, I think we were products and say, we invented this thing, who can we sell it to?
Okay.
Now we're saying, now, hang on a second, let's talk about customers. And let's kind of segment the customers into specialists and generalists right off the bat. So, a specialist endodontist. We have traditionally focused on them, strictly selling them endophiles. Pick your brand, Mayfair, VFW, other things. We get excited about the opportunity to do that. But now we're starting to say, well, hang on a second. That endo used a lot of other products, and how are we going to reach them? So we think about that. In something like implants, and if we went to a specialist implantologist, we're actually saying, hey, what are they using for imaging? What kind of imaging? If we can actually get them to use a cone beam, we think that's going to give them a much better chance of a really, really good workflow and good treatment guideline planning, because you're providing additional detail, and it might lead to them buying a surgical guide, which we make, or something that we can mill. So we start with that idea of who is the dentist, and then what are they trying to do. So let's go to the general dentist. And one of the things that I think is the biggest trend we've seen in dentistry over the last 10 years is the availability of generalists to be able to do some very basic specialist procedures. So a lot of generalists may say, I think I can do some clear aligners, or I think I can do some basic single tooth implant, or maybe I can do a single cavity root canal. So, as you think about that, one of the things that we believe is Dentsply Sirona, our equipment can help provide the diagnosis, and more important, help you develop a treatment protocol or a treatment plan for that patient. And then we're going to go another step further. We think it's our responsibility to actually provide the continuing education to the dentist. And one of the things that we're very, very proud about is whether it's a physical place like our dental academy in Shanghai and Bensheim, Charlotte, or the close to 90 little training centers where you can get hands-on experience and training, or we gave 12,000 courses online last year that touched 400,000 dentists. So we go back. What kind of dentist? What procedure are they doing? How can we help combine our products in such a way that we're helping improve the outcome for the patient and make the workflow work better for the dentist, and then educate them about not only the clinical aspects but the procedural aspects of how our products can help them.
So from a leadership perspective, making those decisions to focus on continuing education or on the end user, how it's going to affect them, not say just developing the new product. In guiding a company of this size, and you came in during a very interesting time for Dentsply Sirona, what leadership kind of ethos do you have in steering this ship?
Yeah, it's interesting. I actually believe the role of the CEO is to focus on two things, is strategy and culture. And then basically after that, you're there to empower your people. And it's really, I've come to Dentsply Sirona. It wasn't a very interesting time, but I've been able to hit so many of our sites, met so many of our people. And what I found is I've been in a lot of companies, I've been around a lot of companies, I've been doing this for 35 years. I've never met a group of people so passionately committed to their customer, the quality of the products. I mean, it's absolutely amazing. One of the first places I got to go was one of our oldest facilities in York, Pennsylvania. And I met a woman who had been manufacturing teeth for 43 years. I met her daughter and her granddaughter, and they were all about making sure, hey, you're the CEO, but we really know what we're doing. And to be honest, what I've been saying is, look, our responsibility for the dental community is great innovation, and then bringing out high quality products. So the strategic part of that is relatively easy. And if you're going to innovate, it's a really interesting time for the dentist, because they may have been out of school for 20 or 30 years and the technology is moving incredibly fast. I think we have a responsibility there to actually make sure that they know how to use our products, how to do the procedure correctly. And after that, it's like, okay, let me get out of the way of these people. And you're here at IDS, Zach, so go out and talk to our people, and they're going to show up as excited on Friday as they were on Tuesday, despite the fact they probably talked to 100,000 people.
Sure. And last question then, how far out are you looking right now in terms of the pace of change and where you have to make your decisions about where to innovate? 1 year, 5 year, 10 years. What's the future for Dentsply Sirona?
Yeah, it's interesting. Two of the hires that we were able to announce in the last month is we have a new CTO, a gentleman that's coming to us from Merck and has a great background in not only materials and innovation, but also technology and equipment, a guy named Cord Staler. So he's coming to us in May. So we have a new chief technology officer, and we just added a new chief strategy officer, a gentleman by the name of Matt Kogan, who comes to us from Aura Pharma. So he spent 20 plus years in the kind of the pharmaceutical oral health business. So literally their first charge is, okay, you guys have to work toward that 10-year true north. But, you know, I would tell you, you know, and you come here at the show, things kind of jump out at you. And the first thing is, boy, I think we all have to be ready for digital dentistry to take off in ways that we're not quite ready for. I think digital dentistry has been driven right now pretty much in the ortho space where people want to do clear aligners. I think that the quality of the equipment we're putting out with something like PrimeSkim is going to make it standard of care. I think you're going to walk in, you're going to check in, you're going to see the receptionist, it's going to take your name, and it's going to do a scan. It's going to take a minute, and that's going to track your gum health. Right. It's going to track tooth movement. And I just think we're beginning to understand, boy, if we were able to track you over 5 to 7 years, think about all the data. And with AI, how is that going to help the dentist begin to explain what a treatment plan may look like over a 3 to 5 year time period, whether it's for aesthetic benefit or oral health benefit. So I think the digital revolution is really going to make its way into general dentistry. You know, the second thing that's kind of, you see it here, is the availability of materials and things like 3D printing. In my mind, is going to be a relatively significant change. And, you know, how do we think about what gets done where going forward? I think some of the labs are bringing unbelievable 3D printing technology. Does that get reduced all the way down to chairside? You know, the last thing I think is going to be a great question for dentistry is the quality of the diagnostic data is getting better, faster, cheaper. And what are we going to do with it all? So, you know, the interesting idea of, you know, somebody was taking a single X-ray on you know, a 2D and by hand thinking out what a treatment plan is going to give way to the idea that we're going to be able to look at 3 to 5 years of how your mouth is performing. We're going to be able to combine X-rays with images in a way, and we're going to be able to compare it to, say, 2 to 5 million other cases where we've been able to see it. And what does that tell us about what a treatment plan looks like, and how, you know, if left untreated, this is what it may look like. So I think the sophistication of the diagnostic to treatment plan that's going to be put at the fingertips of dentists is going to be dramatically different. So in my mind, what our job is as Dentsply Sirona is, boy, we're in that, you know, the technology and equipment business, we're in that consumable business, but to be honest, we're probably in the dental service business, and we're going to have to focus on treatment planning at a scale we haven't thought of, and then slot our procedures, our workflow into that. So you almost, in our mind, have to think about a totally different company that's going to be an information-based company that is going to be interacting in a much different way with dentists in 5 to 7 years than we do today.
Those are big decisions. I don't know if I'd like to be in your shoes or not. And speaking of shoes, we'll get a shot of these.
There we go.
Everybody on the floor for Dentsply Sirona has gotten the sneakers on and the no-tie look. Totally intentional. I love it. My shoes are not that comfortable, so I applaud you for that. Great talking with you.
Great. And thanks, Zach. We really appreciate it. Look forward. 2 years from now, we'll come and we'll compare our notes.
Sounds good.
About where dentistry landed.
Yeah, who knows? We'll see.